Hi, my name is Kristen and I'm a social worker with Alberta Health Services. Welcome to this video about the transition from pediatric to adult healthcare for youth who will make their own decisions as adults. Healthcare transition is when your medical care will move from the child-centered pediatric setting to an adult healthcare setting. This includes preparing for the move itself, and adjusting to the new healthcare setting. Like other life changes, the transition from pediatric to adult healthcare can be both exciting and stressful. It can help to start planning for this healthcare transition ahead of time. The actual move to adult healthcare is a one-time event that happens at around 18 years of age, but transition happens over a longer period of time. You and your parent or caregiver may choose to begin the transition process as early as 12 to 13 years of age. It helps to know what to expect during healthcare transition because there are many differences between pediatric and adult care. In this video, you'll learn what you can expect during healthcare transition and how to prepare for it. Your parent or caregiver has likely been responsible for making appointments, talking to your healthcare team, and filling prescriptions for many years. Adult clinics usually expect patients to do these things, especially if they're able to make their own decisions. They may expect you to make and receive phone calls from the clinic, attend appointments on your own, answer questions at clinic visits, and make your own healthcare decisions. Attending appointments alone can be a big change. If you want your parent or caregiver to attend the adult clinic appointments with you, let the clinic know that's your preference. Supported decision-making gives adults who can make their own decisions the option to have someone help them make and communicate decisions not related to financial matters. Completing a supported decision-making authorization form is all that's required to receive this type of support. Also, your parent or caregiver won't have access to your health information once you become an adult. If you want them to have access, you'll need to sign a form to make them an authorized representative. This option is available through the Health Information Act. Completing the authorizing a representative form is all you need to do. Adult care is not a one-stop shop. Your healthcare team may include specialists at several locations. It's important to have a family doctor or nurse practitioner who will help you and your parent or caregiver coordinate care and navigate the adult healthcare system. There may be different eligibility criteria to see a specialist in an adult clinic. Family doctors or nurse practitioners may need to monitor your specific health concerns and make referrals to new specialists when needed. Appointments with your adult specialty clinics will focus on concerns related to the clinic's area of expertise. They may suggest that you talk to your family doctor or nurse practitioner if you have questions that aren't related to the specialty clinic. Adult clinics may not have the same supports that your pediatric clinic does. Therefore, it may be more difficult to access care provided by occupational therapists, physiotherapists, social workers, psychologists, or other therapists. If you need these services, you'll have to ask your healthcare team how to access them. Good communication with your new healthcare team is very important. So is ensuring that you and your parent or caregiver understand what the adult clinic expects from patients. For example, you may need to clarify who is responsible for booking follow-up appointments. Will the clinic contact you with an appointment time, or is that your responsibility? If you miss an appointment, adult clinics may not call to reschedule like some pediatric clinics do. Some may even discharge you from their clinic and require a new referral so that you can see them again. You and your parent or caregiver can ask questions about how the new clinic works at your first appointment with them. Wait times in adult clinics and emergency departments are often longer than for pediatrics. The appointments may be shorter or less frequent. If you feel like there isn't enough time with your healthcare provider or that you aren't getting your questions answered, going to appointments prepared with a list of questions can be very helpful. Here are some ideas of how you can prepare for the change. Find a family doctor or nurse practitioner you like and who you can continue to see as an adult. This is important. They're the ones who will coordinate your care. Family doctors and nurse practitioners make referrals to specialists when needed, receive results from medical tests, and are generally the most consistent member of your healthcare team. Have your parent or caregiver help you learn about your medical condition. You should know the name of your medical condition, how and when it was diagnosed, and what's known about the cause. Learn about your treatment options and what you can do to take care of yourself. Learn about your medications, including the names, how much and how often you take them, and why you need to take them. Know whether or not you need to follow a special diet or avoid certain foods. You should know the signs and symptoms to monitor, what to look out for, and when to see your doctor. Do you need regular lab tests? Learn about which lab tests you may need to have and when to have them. Some adult clinics will ask you to get lab tests prior to an appointment so they can review the results with you. Learn about the long-term effects of your medical condition. Consider what impact your medical condition may have on your career options. Learn about adult programs, as well as funding options for health insurance and/or a monthly living allowance if you have a condition that will impact your ability to earn a living. Here are some ideas of how others can help you prepare. Have your parent or caregiver teach you about your health history. Learn about the medications you currently take, names of previous medications, and why you stopped taking them. You should also learn about any previous surgeries you've had and why you had them. If your medical history is complex and could change over time, keeping track of it digitally or on paper may be helpful. Learn how to keep track of your health information. You'll need to know things like dates, times, and locations of medical appointments, as well as names and contact information for your healthcare team, pharmacy, and lab. There are paper or electronic ways to access and manage healthcare information. MyAHS Connect is one example. Encourage your parent or caregiver to help you gradually take on more responsibility for managing your treatment plan. They can help you set up a routine and reminders to take medications. Ask them to teach you how to reorder or order your prescriptions, as well as how and where to pick up medication or other equipment and supplies you might need. Practice talking to your healthcare providers by asking and answering questions at appointments. Book your own medical and lab appointments. And consider meeting with your healthcare provider alone to talk about sexual health, mental health, and lifestyle choices like drinking, smoking, or drugs. It's important to know that you always have a right to privacy and confidentiality. However, there are times when it's important to share information too. Talk to people you trust to learn when and how to share information about your medical condition. Your transition to adulthood may be stressful and full of uncertainty and challenging. But remember, you're not alone. Talk to your healthcare team if you need help or want to talk to another teen who's gone through this transition. Professional or peer mentor support is available for you and for your parent or caregiver. Feelings of sadness over losing relationships with your pediatric healthcare team are common, as is fear of the unknown. Give yourself time to feel comfortable and establish a trusting relationship with your new healthcare team. Thank you for watching this video on transition from pediatric to adult healthcare for youth who will make their own decisions.
Find information, support, and services for you and your child by clicking on the link in the description.